Hi guys, it's me Fatima, Dr. Qureshi again. So, like I promised, we're going to talk about other cases. Today I will tell you about a case that I just saw. I'm just actually leaving from work. It was a Chiari malformation. The girl was 21 years old, white Caucasian female. She came in with severe headaches and decreased vision in both eyes, and she was just like crying, and her mother was there, and she was like, Dr. Qureshi, please help my daughter. She's just suffering with severe headaches. Unfortunately, the primary care doctor was giving her codeine and all kinds of painkillers, and she was just not feeling comfortable, right? And her vision was going really, really bad. So after dilating her and looking at her optic nerves, there was a big swelling of the optic nerve head. They were elevated, and I wanted her to go for an emergency CT scan and MRI of the brain, which she did get done. But after that, she came back and she said, well, I wanted to know if there was hydrocephalus, and there was, but I don't know, for some reason the PCP and the neurologist were not agreeing on doing a spinal tap. Again, like I said in the last video, we had to send her to Baton Rouge. We keep sending our patients to Baton Rouge. There's a very good neuro-ophthalmology department there who takes care of our patients from Lafayette. This patient I actually saw in the Youngsville office previously, and then today here. So anyhow, long story short, after getting the spinal tap done from the neurologist in Baton Rouge, he put her on spironolactone and also acetazolamide, which are both diuretics or water pills. And after getting treated for about a few months, she came back. Her vision is so much better. Her headaches are absolutely gone. She's still taking the pills and she feels brand new. So read about Chiari malformation. There are different types. There's type 1, there's type 2, and then type 3. Type 1 mostly shows up in adults, like in her age group, I would say. It's not as severe as the other one. Type 2 is something that's congenital, and type 3 is really severe. It's like one of the most lethal types. Chiari malformation is also very rare, I would say. So what is it? It's the protrusion of one part of the brain, which is the cerebellum, which is towards the posterior part of the brain, and starts protruding through the opening in the skull and then goes into the vertebral column. So it can push and compress on the brain, and it can also go and compress on the spinal cord. So some of the symptoms besides or other than loss in vision and headaches could be difficulty with breathing, difficulty swallowing, there could be neurological problems, so on and so forth. And in one type of Chiari malformation, there is less protrusion of the cerebellum, maybe like cerebellar tonsils that go into the vertebral column, but also it's like smaller, shrunken cerebellum, so that the brain has so much of fluid accumulation, or at times it can be pushing on the brain. And so we all know there's optic nerve that I want to see as an eye specialist. I want to be careful in monitoring the optic nerves, and I noticed there is an elevation of the optic nerve, which could be from the brain. Probably there is fluid, which is known as hydrocephalus, which is pressing on the optic nerve, or there's a mass lesion, mass formation in the brain that could be pressing on the optic nerve. So direct continuation of the brain is the optic nerve, which is the second cranial nerve, and that is of the most importance to me as an eye care specialist. Okay, so that was about Chiari malformation. See you guys next time. Bye.